of us have those little spots on our bodies that we wish we could minimize. You know what I'm talking about, whether it's that extra layer of fat that no amount of sit-ups will get rid of, or those upper arms that you'd rather your grandmother had not passed on to you. Well, today on Aesthetic TV, we are learning about a revolutionary new treatment that addresses these exact issues. We're lucky today. We're speaking with Dr. William Philip Werschler, and Dr. Werschler is both a board-certified dermatologist and cosmetic surgeon, as well as a faculty member at the University of Washington. He's also an FDA researcher and investigator. Dr. Werschler, thanks for being with us today.
Thank you, Suzanne. It's a pleasure to be here.
Now listen, you have been performing liposuction for what, more than 20 years now?
Yes, that's correct.
Okay, well tell us about why you are the person to be doing these things and what you know about the procedures.
Well, this is really an exciting and it's a breakthrough technology. It has really changed the way that we fight fat. So previously you had to go inside the body and suck the fat out.
That's traditional liposuction.
Traditional liposuction, and sometimes that could be done with a laser, but that's still going inside the body. Now with the Liposonix system, what it does, it's all external. It's using the power of ultrasound. Now, we're very familiar with ultrasound. Most people have had ultrasound at some point in their life, and certainly all women that have had babies know about ultrasound. So we know that ultrasound is very safe, it can be very gentle, and it's a very, very highly accurate type of energy system. And here what we do is we focus the ultrasound onto the fat layer and use the energy of the ultrasound to melt the fat away.
Okay, so this is Liposonix, not liposuction, correct?
Liposonix,
Liposonix.
correct.
And Liposonix can be used to treat where, specifically?
Well, anywhere. We have a saying, that is, if you have an inch, you qualify. So
an inch you don't want? Or
if you can pinch an inch,
yes,
that works. Now you can use it in the traditional areas that you think of, such as the abdomen or the waistline, the spare tire,
sure,
or the muffin top, we sometimes call it.
I hate that word.
You can use it on the buttocks or the thighs or the outside of the thighs, what we call the saddlebag areas.
Right.
Even on the backs of the arms. So lots of different areas.
Now, how is ultrasound specific to this process?
Well, the energy used to melt the fat is actually the ultrasound. So what happens is there's a transducer, there's a round disc that is placed on the outside of the body, so there's no incisions, no cutting, anything like that. The transducer delivers the energy into the fat where it breaks up the fat cells and it melts them, and then the fat cells go away, and so does the extra unwanted area.
So it sounds like that the ultrasound is actually very focused and specific.
It's incredibly specific, and so really this concept of treatment of this Liposonix fat melting is really not to remove large body areas of fat. It's about focusing on those specific areas that have been stubborn, that have been resistant to the diet and the exercise,
right,
or maybe, as you mentioned, was a gift from your mother or your father.
Right.
It's like, how did I get those thighs, or how did I get that waist?
Yeah.
And so you can specifically go into those particular areas and you can spot reduce.
Right. I like the way you're talking about that, melting the fat. That's very different than removing the fat. It's sort of, it seems more natural. It just sort of, put it away.
Well, as you know, when we exercise, when we diet, what we're doing is we're restricting the calories or burning off extra calories, and our body makes up for that deficit by metabolizing fat that is stored in our fat cells.
Now, here's a question for you. Since it's non-surgical, what's the downtime like?
Well, very minimal downtime. I mean, this really is an hour. We have another saying, it's one treatment, 1 hour, one size. So this really can be a drop-by treatment. You come in, you have the treatment done, and you just go home.
Now, Dr. Werschler, I understand that your wife, Pam, is actually a nurse practitioner of yours, right?
Correct.
And she's had this procedure done?
Yes, she has.
Okay, and she's with you here in the studio, right? She's going to come out and tell us what her experience was. Let's bring her on. Come on, Pam. Hi, welcome to Aesthetic TV.
Thank you so much for having us.
I see. You look amazing.
Well, thank you.
Oh my gosh. So what area did you have done?
I had my abdomen done. That was my inch to pinch.
Wow. Well, the inch has been successfully pinched, I guess.
It has, absolutely.
Tell us a little bit from a patient's perspective what it was like to go through this Liposonix procedure.
Well, basically there's just a warm, tingling sensation when the transducer is placed on your skin and the energy is delivered. After that, there's nothing that happens at all. There's the skin is sort of touch, maybe for like a few days afterwards, but basically nothing. There's no downtime.
And what about pain? Was there minimal pain or?
Minimal pain, yes, very easy.
Wow, well, that's good. You know, you look amazing. I know you seem like it was effortless. Is that saying too much?
It truly was.
Really?
Yeah, in an hour and then you're off the table.
I'm-
Actually, for me, my spot was small enough, it was 10 minutes.
And just one treatment?
One treatment.
Oh my gosh. All right, well, this is very exciting news. And if you don't believe just Pam, we also have some before and after pictures, I think, to take a look at of another patient, correct?
Yes, that's correct, Suzanne. These are actual unretouched photos of a patient who
Wow.
had the Liposonix treatment done to the abdomen. And you can see the before and 90 days after, so it's a 3-month wait.
How many treatments did that person have?
And that was just one treatment.
Are you kidding?
Yeah.
Okay, this is getting more exciting by the minute for me. It really is. Oh my gosh. And you said no anesthesia required.
No anesthesia required. There's no stitches. There's no special garments to wear. It really is a treatment where you come in, you lie down on the table, you have the treatment performed, and then you get up, put your clothes back on, and leave.
I hate to say this, but it's true. It sounds almost too good to be true.
It does. It is a revolutionary breakthrough in technology of fat removal or fat destruction, and this is something that we've been waiting for a very, very long time.
It sounds amazing. Now, it sounds so good, I have to ask, why have I not heard about this?
Well, because it's a new technology. And like all new technologies, it takes a while to really get the word out. In part, that's why we're here today on Aesthetic TV talking about Liposonix. So it takes the manufacturer a while to get everyone trained, to get the machines installed into the different medical offices. And you will hear a lot more about it, but it just takes a little bit of time.
Is it because of your background with research and all of that your offices were chosen, or how did that come about?
Well, Suzanne, as you had mentioned earlier, I've actually been doing liposuction for 2 decades, so I'm very, very familiar with liposuction. I'm also a laser surgeon, and I'm very familiar with energy devices. And really, this is kind of a melding of the experience and the technology, and we're fortunate to be on the forefront in bringing this to our patients.
This sounds just like an amazing procedure, and with what you're saying about it, Pam, it makes me think, why can't I go right now and check it out, see what I need, and get it done? So I have to ask the most logical question that's remaining is, how expensive is it? Is it affordable?
Yes, actually, it's very affordable because it's a non-surgical procedure. You don't have all those other associated costs of the operating room and the anesthesia and those types of things. I mean, this is really a procedure that's just done in the privacy and the convenience of the office treatment room. So it's less than liposuction or less expensive than laser liposuction. How much it costs would depend on how big of an area or how many areas that you want to have treated. And that would be something that we would discuss in a consultation.
And is that something if Pam decided, you know, in another year, hey, now I'd like to do something on my arm, she could go back? It's something you could do again and again?
Absolutely. You can have it done as many times as is necessary to achieve the effect that you want or the effects in different body areas.
I know everyone listening in is going to want to know how they can get this done. Is there anybody who would not be a good candidate for this, who should avoid Liposonix?
Yeah, and that's an excellent question. And certainly if you're pregnant, you're not a candidate for this. And if you have any implants in the area, many body implants in the area that's being treated, then you wouldn't be a good candidate
In
either.
the area that's being treated?
In the area that's
Okay.
being treated, correct.
A good distinction to make there.
And one thing that we do ask is afterwards. There's really no aftercare, but we ask that because you're releasing the fat and you want to purge that from your body. We encourage you to eat a diet high in antioxidants, eat some blueberries, drink some green tea. So it's all very natural.
I have no doubt that when people hear about this, you're going to have people lining up around the block for this procedure. And when I say lining up around the block, I mean your block, because you can't get this anywhere, can you?
Well, you're correct. It's only available in limited areas, and we're fortunate that we're the first office in the inland Northwest to offer this procedure of Liposonix fat melting.
Well, thank you both for being on the program today. Now, you can visit Dr. Werschler at his Spokane office or go to liposonixspokane.com for more information about this amazing procedure. Thank you again, and we sure hope to have you back here on the show.
I'll look forward to that. Thank you, Suzanne. I appreciate it.
Thank you so much, Suzanne.
Thank you, Pam, and thank you for watching.